God, you're so cute.
Oh,
What's your big schnoz? Where are you going?
It's so sad when I think they go. I feel so
She feels so great.
Oh, wait a minute.
There it is.
There you go. What is that?
yep, that's the piece of blanket for sure.
That is the surgery.
That's surgery right there.
Yeah, this is better.
Oreo's here for bilateral Pyothorax. She was seen by her regular veterinarian yesterday for difficulty breathing, and on radiographs it shows that both sides of her chest have fluid in it. The fluid was tapped and tested and came out moderate amount of blood, a large amount of white blood cells, which suggests that is purulent and bacterial, a purulent infection. In this particular dog, this is a hunting dog, it's not uncommon for them to get a piece of grass or a thorn or something through the nasal passages and into the lung that can cause the infection. So the immediate concern with her is getting the fluid out so she can breathe. We placed a chest tube on the left side of her chest a couple hours ago and removed about 1,200 ml of fluid. However, the post-tube placement radiographs show a significant amount of fluid on the right side as well, so we need to put a second chest tube in to allow her to breathe better.
Hi, I'm Dr. Jeff Runge. I'm one of the attending board-certified surgeons here at Guardian Veterinary Specialists. I'm also a subspecialist in minimally invasive surgery, and I had the opportunity to work with Oreo, who is a 3-year-old German short-haired pointer who is also an active working dog and a hunting dog. So Oreo was actually diagnosed with something called a Pyothorax, which means pyo being infection, thorax being chest. So there was a massive infection that was going on in his chest. And this is actually something fairly common that we see in a lot of hunting dogs. For that matter, it sometimes can occur because of a foreign body or an object either penetrating into the chest cavity or potentially in some instances going through the nose and migrating that way. Occasionally it can also be transmitted through the blood and setting up shop in the lungs as well. But these 3 particular routes are fairly common for hunting dogs because they're exposed to a lot of different environments and they're often under a lot of stress and they're running and they can injure themselves. So these objects or sometimes foreign material can bring bacteria into the chest cavity. What happens is the infection sets itself up in and around the lung cavity. So if this is the thoracic cavity of a dog, you can actually see here this representation. The head would be over here. These are the 2 forelimbs, these are the hind limbs. The chest surrounded by the rib cage is where we're talking about. So a fluid that is not quite fluid, but almost like pancake batter, builds up around the lungs and it causes a very major problem for the dog to breathe. So what we can do surgically is something that's actually minimally invasive. We can actually go in with cameras in between the ribs and actually come in and be able to actually watch and see our infection that's going on there and clean it. We can use a special device that actually suctions, lavages, and cleans, almost like a power washer, all the surfaces inside the chest cavity. And we can do this through very tiny little incisions between the ribs. So unlike having to, let's say, cut the ribs open or saw open the chest, this allows us to do this procedure minimally invasively and very effectively for that matter. So some of the video that you'll see now is taken that shows what the inside of this particular dog's chest looks like. It allows us to evaluate the lungs. It allows us to see the other surfaces inside the chest and actually take samples and clean off the debris that's there. Once we're finished with the cleaning portion, all the fluid and all that debris is sucked out. We then take our samples for biopsy and for culture, and then what we're able to do is close up those tiny little holes. Before we do that, we put a small chest tube in, which allows us to continue to drain the fluid, but also to keep negative pressure. That chest tube's only in place for 1 or 2 days, and then it gets pulled depending upon how much fluid is being produced. The great news is Oreo did fantastic after surgery, and Oreo went on to a wonderful recovery and is now back at home right now doing very well. We did culture a bacteria that grew. We did not exactly find the source of what caused this, but we did figure out what type of bacteria it was, and we treated it with the appropriate way. This method of minimally invasive cleaning is actually something that my team and I had published previously on, and we did some great multi-center analysis of this type of case and how we can actually treat them, and it goes to show that minimally invasive techniques are fantastic, and it helps dogs like Oreo have a minimally invasive surgery and be able to go home at a much sooner time and have a shorter hospital stay and be less painful.